Today we're going to be assessing hip abduction, which is testing your gluteus medius and tensor fasciae latae. We use this quite a bit with hip patients with hip pathology, whether osteoarthritis, labral pathology, post-operative care as well, and of course with low back pain, because the hip and lumbopelvic spine and the lower back all quite related. So we'll get some objective information from you to get some hip strength. What we will use is a K-push today. Go ahead and lay down on your side. We usually leave one of these straps on the table. Go ahead and leave your bottom knee a little bent and the top leg straight through, just like that. And you're going to push straight up into the strap, just like that. And so because typically the traditional position is in supine on your back, we're going to do it on your side to assess your ability to stabilize your hip as well, your pelvis as well. So we can create this position specifically for our needs very simply. Once we start the activity, the device will sync with the app. We're going to start on your right side. You're going to push for 3 seconds, 3 times, with a 3-second break in between each one. Okay? Here we go. So 3, 2, lift up, 1, and push. Go. Push, 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 push. And the strap allows us to have an immovable object there. And go, push, go, 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 go. Good. One more time. 1 and go. Push, 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 push. And relax. Excellent. Let's move to the other side. You're going to push just like this, legs straight, just like that. 2, 1, and go. Push, go, 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 go. Good. Rest. 1 and go. Push, 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 push. Good. 1 and go. Push, go, 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 go. Good. And relax. Excellent. So go ahead and have a seat. Let's look at your data. And what you see is just the peak force of your best repetition. There's a 10% asymmetry. Your right is a little stronger. So we'll look at a little closer the average force of the peak. So the average peak force, 11 kilograms and 13. So about 11% asymmetry, with the right being a little stronger. We want to see this number, this asymmetry, being below 10 and really below 5. We will correlate this information with the clinical exam of where your pain is, how your movement is, how you are generally progressing, in order to assess how and where we need to strengthen you as we keep going. And then we'll be able to view your progress along the way, and it'll be charted as we go. This is your first test, so we obviously don't have different points, but we'll be able to plot the points to see progress as we go. So if you want to utilize this sideline hip abduction test, we'll put the QR code in the app so you'll be able to use it. I find it useful more so than the supine test for clinical data, as it correlates also and helps us to determine whether the patient has any kind of pelvic instability or pelvic pathology as well.